to the 4th UKPHR Innovation in Public Health Awards. We're delighted we can celebrate with you all virtually the achievements of so many wonderful projects in what remains a challenging time for many. This year, we've refreshed the awards program with some new categories. Alongside the Alison Thorpe Award for translating research into practice and the Award for Collaborative Working, we've added the Award for Digital Initiative, Employer of the Year, Improving Public Health Practice for Children and Young People, and the Best Social Media Campaign. These changes have resulted in a bumper crop of entries. So thank you to all of you who found the time to enter. We would also like to say a thank you to our award supporters, Public Health Wales, Solutions for Health, and thanks also to Health Education England for their support for the conference today. This is my first experience with the UKPHR Practitioner Conference and the Innovation Awards, as I've only been in post at UKPHR for less than a year. But during that year, I've seen so much excellent work, dedicated and passionate individuals, and incredible outcomes. It's been such a pleasure getting to know some of the public health professionals who are driving innovation and improvement, and I'm delighted to have the opportunity to recognize them formally and publicly. Our first award this afternoon is the Collaborative Working Award, sponsored by Public Health Wales. Please welcome Dr. Meng Kaw, National Director, Health Protection and Screening Services, Public Health Wales.
Hello everyone, I am Meng Kaw, Director of Health Protection and Screening Services for Public Health Wales. I support this award because one of the key foundations of successful public health practice is the organised efforts of society to gain positive outcomes at a population level. And this can only be achieved through collaborative working between key stakeholders in the system. There were many excellent submissions, and we have 4 shortlisted entries for this award. Louise Hansford, Hep C Elimination Coordinator, and Sean Caddy, Wessex Clinical Van Coordinator, Midlands Partnership Foundation NHS Trust, where through the Wessex Clinical Vans, an innovative outreach service helps to micro-eliminate hepatitis C. Louise Harl-Anderson, Public Health Programme Lead, Gateshead Council and team, whose community champions, as trusted local ambassadors, ensured people heard correct and consistent information during the pandemic, which helped drive vaccine uptake, particularly among asylum seekers and refugees. Michelle Mancini, Health and Wellbeing Programme Manager, Office of Health Improvement and Disparities, carried out an audit of community alcohol services as part of the Alcohol Healthcare Needs Assessment to inform the developing ICS alcohol programme. Rhianne Rosser, Hot Lab Operations Manager, and Kelly Ward, Scientific Programme Manager, Public Health Wales Programme Manager, where the development of the Hot Laboratory Network included the design and implementation of 6 new rapid testing laboratories across all acute hospital sites in Wales. Let's hear now from our finalists for this award.
Hello, I'm Louise from Hep See You Later, and I've come today to tell you a little bit about Wessex Clinical Van, as we've been fortunate enough to be shortlisted in this year's awards in the Collaborative Working category. Wessex Clinical Van spans 2 counties, including Dorset, Hampshire and the Isle of Wight, and it's a massive area, and we've got over 25 stakeholders, which comprises of 7 drug services that normally are in competition with each other for contracts, 5 local authorities, 6 different hospitals, charities, and the really lovely and special thing about this project is everybody has come together with the single purpose of reducing inequalities and addressing unmet needs in relation to hepatitis C. In our first year, we saw over 1,000 people. We diagnosed 110 people with hepatitis C, and all of those have gone on to be successfully treated.
I'm Joanne Smithson. I'm delighted to nominate Louise and her colleagues in Gateshead. This project is a fantastic example of collaborative working. People from a wide range of organisations and communities coming together with a shared vision of improving health and reducing inequity. At a time in the pandemic when so much was uncertain, This project provided a safe, trusted space. Effective communication was vital to build champions' confidence and competence. Working together, they cascaded trusted information in formats that worked. Reacting and adapting to ever-changing circumstances ensured champions were prepared, and champions themselves shared insight on what people they were talking to really needed. The project challenged myths and mistruths head-on. It identified those most marginalised and created bespoke resources. Ultimately, the project ensured that those most vulnerable received the best possible care, but a truly inspirational project.
My name is Michelle Mancini, and my project was a health needs assessment of alcohol treatment services in the North East and North Cumbria integrated care system. The aim was to explore the views and experiences of community alcohol treatment commissioners and providers to identify gaps in provision and areas for improvement. The findings were then fed into a larger healthcare needs assessment which produced overarching recommendations for the NHS, local authorities and treatment providers. I developed a self-assessment toolkit which focused on 6 key themes derived from national standards and guidelines and the evidence-based Alcohol Clear self-assessment tool. Key findings and recommendations included the need for strategic leadership, dedicated analytical support to inform service design and delivery, effective information sharing protocols and referral pathways, strengthening transition from young people to adult services and targeted approaches to engage young people, a concerted effort to expand workforce to improve skills and competency levels, and embedding whole system community-centred approaches.
The development of a hot lab service was always a strategic priority for Public Health Wales. This was expedited in response to the COVID-19 pandemic. A business case was submitted to Welsh Assembly Government by Public Health Wales in August 2020, which was approved to be implemented by November 2020. This gave us 3 months. This required identifying suitable laboratory space, procuring equipment, consumables, as well as establishing process and recruiting staff. This required extensive collaboration with other Public Health Wales microbiology colleagues, finance, estates, procurement, medical and health board colleagues, which was challenging due to world demand and project timescale. Meetings were held to discuss the benefits of a rapid testing service with health board colleagues. This was also presented at the Welsh Medical Directors Board. The hot lab began testing as planned in November 2020 with significant patient impact, improved patient flow, reduced delays for pre-op patients, bed management, discharge and benefits for both paediatrics and labour wards. This project is in line with the Public Health Skills Knowledge Framework as it involves collaborative working and demonstrated advance in scientific process.
The judges thought this was an impressive initiative to improve the uptake of COVID vaccinations, a huge collaborative partnership and a worthy winner. The winners are Louise Harl-Anderson and the Gateshead COVID Community Champions. Congratulations to the team.
Our second award this afternoon is the Award for Digital Initiative. Please welcome Linda Smith, UKPHR board member, who's going to introduce the finalists.
Hi, I'm Linda Smith, Public Health Specialist and a Board Director for UKPHR, based in Aberdeen in the northeast of Scotland. It gives me great pleasure to introduce the 3 shortlisted finalists for the Digital Initiative Award and reveal the winner. The 3 finalists are Emma Mason, Public Health Programme Manager, Leeds University, and Val Barker, Head of School of Public Health, Health Education England, for development of a digital signposting tool to support frontline police officers to apply a public health approach to policing. Jennifer Watt, Anticipatory Care Programme Manager, NHS Greater Glasgow and Clyde, who converted the Improving Health, Developing Effective Practice course for online delivery during the pandemic. Kenna Campbell, Health Improvement Senior, Glasgow City Health Improvement Team, NHS Greater Glasgow and Clyde, who produced 4 animated videos to raise awareness of breast, bowel and cervical screening for ethnic minorities. Let's now hear from our finalists.
LeftLink is a simple online app designed to support frontline police officers with access to the public health information they need at the click of a button. The LeftLink app provides a simple list of topics which can be accessed quickly from a mobile phone or PDA type of device. Within each topic, the officer can find a range of open engagement questions via the Ask, Assist and Act tab. Or they can simply navigate to the Act section, which provides the officer with a range of self-care, national and local support services. We are able to track the use of the app through Google Analytics. This allows individual police services to evaluate the success of this approach.
I'm a great believer in that probably somebody somewhere's got experience of it, and it's about kind of pulling that in and saying, what did you do in that situation, or what can we do here? So it's, for this course has been really good for that for me, yeah.
Having the practical examples and being able to relate to that, it's been really useful rather than just a course where you sit and nod and kind of just learning and writing down and not really doing the practical stuff.
I'm going to be learning to use some more stakeholder analysis and PDSAs and I love all that stuff now. It's great.
This course has really helped me with my critical thinking.
And so a lot of people at the office are working from home, so I've now got the opportunity to kind of just pick people's brains. So this has been really good for the theory and the practical, the application, the contextualising, swapping stories.
There was lots of light bulb moments in the course.
Judges thought that the winner showed a highly creative and innovative use of digital technology which had clear health benefits. And the winner is Kenna Campbell, Glasgow City, and the cancer screening animations for ethnic minorities. Congratulations, Kenna.
Our next award recognises the Employer of the Year. Let me welcome Ranjit Kutan, UKPHR board member, who's going to announce the finalists.
Hello everyone, I'm Ranjit Kutan, a director of the UK Public Health Register and head of public health at the University of Wolverhampton. I am delighted to be introducing the shortlisted entries in this category. Our shortlisted entries are Lucy Smith, Public Health Principal, Buckinghamshire Council, who actively supports practitioners by promoting and encouraging attendance at information days and supporting applications, references and testimonials. Sarika Sharma, Senior Public Health Specialist, City of Wolverhampton Council, who has undertaken a radical programme of workforce development to nurture a highly skilled public health workforce. NHS Greater Glasgow and Clyde Workforce Development Group, for the consistent way they have supported and encouraged practitioners on their registration journey. Let's find out a bit more from our finalists.
Outstanding Employer of the Year, Buckinghamshire Council Public Health Team. The Buckinghamshire Public Health Team actively encourages and supports the registration of practitioners, and we do this in a number of ways. We are part of the Thames Valley HEE Trainee Practitioner Programme, allowing people to develop their careers in public health by gaining experience and becoming a registered practitioner. Our job descriptions include our commitment to support registration, and it is discussed at induction. Our appraisal process supports practitioners to identify their development needs against the 34 standards and how these will be addressed. We have an active CPD programme to enable practitioners to gain and maintain up-to-date knowledge linked to the standards. As a team, we support the running of the scheme by volunteering as mentors, assessors and verifiers, helping not only our own practitioners but the wider public health family. We have several practitioners undertaking registration this year, which is an opportunity for us to further develop our support for practitioners, and they will be able to champion the scheme and the benefits of registration to other team members.
Our journey of workforce development in Wolverhampton started over 4 years ago with the development of a public health vision. Through that, we coined the phrase of growing our own. We wanted to make sure that we had a public health workforce fit for the purpose and ambition set by the council in terms of public health. So through that, we used the UKPHR framework as a way of making sure that staff were adequately trained, and also made sure that we had a feeder organisation working through the University of Wolverhampton to talent spot those people who were coming through to give them job opportunities locally within our council. Everybody comes into our department within a certain level through generic job descriptions in public health are enabled to have an MPH study paid for and protected learning time, action learning sets to make sure people learn together, but also they get the wide experience to enable them to look at all the different disciplines within public health. And that's put us in a really decent position to be able to tackle the pandemic and the various different challenges that came through that. All in all, we're fit for purpose. We're proud of our ambition and our achievement in Wolverhampton.
NHS Greater Glasgow and Clyde is the largest health board in Scotland and one of the largest in the UK. It employs over 38,000 staff across a wide range of disciplines. One of those disciplines is the health improvement workforce. Many of the health improvement workforce aspire to become UKPHR registered public health practitioners. NHS Greater Glasgow and Clyde support this process by allocating 30 hours over a 12-month period for anyone wanting to undertake portfolio development. This 30 hours is also given to assessors and verifiers to help support the scheme. In addition, staff have access to a wide range of workforce development champions and a wide range of learning opportunities to help them get through the portfolio process. It's for this reason that I nominate NHS Greater Glasgow and Clyde for the Employer of the Year.
The judges saw this as a fantastic opportunity for students to get first-hand experience of working in a public health team. And I am delighted to announce that the winner is Sarika Sharma, Senior Public Health Specialist at the City of Wolverhampton Council. Congratulations, Wolverhampton.
Now on to the award for improving public health practice for children and young people, sponsored by Solutions for Health. Please welcome Sarah Banborough, Associate Director of Public Health, Solutions for Health, who will introduce the shortlisted entries.
The standard of interest for this category was extremely high, and we have thoroughly enjoyed reading them all. And we're delighted to announce the 3 finalists. Firstly, we have Sophie Wilden, Child Health Programme Manager, Medway Public Health, for her programme that gives parents the opportunity to learn about key PSHE topics, including puberty, mental health and sexual health. Secondly, we have Diane Borian, freelance early years consultant, Andrea Lagos, public health strategist, and Matilda Kerr, health improvement officer, Harrow Council Public Health for Healthy Early Years London, which is an award scheme which supports and recognises achievements in child health, wellbeing and development. And finally, we have Sophie Wilden, Child Health Programme Manager, Medway Public Health, who designed and delivered a relationships and sex education programme for young people at HMYOI Cookham Wood to reach marginalised young people. Let's hear from our finalists for this award.
PSHE for Parents is a 10-week programme that has been developed and delivered by myself and colleagues here at Medway Public Health. The aim of the programme is to provide parents and carers here in Medway with the opportunity to explore core PSHE topics. This has included online safety, puberty, sexual health and mental health. The course has given parents and carers the opportunity to safely explore topics that maybe are a bit taboo, or topics that they may not have had the opportunity to learn about in school. Each session provides the opportunity to explore topics, to gain knowledge and understanding of those topics, and also to build the confidence of parents and carers, exploring ways in which they can talk to their children and their families about the things they have learned about at the sessions. Each session also provides the opportunity to explore local services and the things that can support themselves and their children locally. We're so thankful to have been able to pilot this project with our Medway schools, and we are excited to see where this project will go in the future.
Hello, my name is Matilda. I'm the Health Improvement Officer at Harrow Council, and I've nominated us for a UKPHR award for our work on Healthy Early Years London. So Healthy Early Years London is a whole-setting approach to addressing health, wellbeing and education and reducing health inequalities in line with the Mayor's Health Inequalities Strategy. It is a tiered award programme for early years providers that progresses from bronze to silver to gold, and it involves completing audits of practice and case studies on specific health and wellbeing priorities. So in the last year, Harrow has achieved 2 bronze, 4 silver and 4 gold awards, which we're really pleased about.
RSE for All is a 10-week relationships and sex education programme that I have developed and delivered to young people in YOI Cookham Wood here in Kent. The aim of the programme is to break down barriers to education for young people in custody and allow some of the most vulnerable children in our society the opportunity to access high-quality relationships and sex education. Many of the young people I work with at Cookham Wood had not had a good experience of the education system, usually due to lack of attendance, and this can be through exclusion, mental health needs, involvement in youth violence, and additional learning needs that maybe have not been met and supported. This programme gave those young people the opportunity to have a safe space to safely explore important topics such as healthy relationships, consent, and sexual health. All children in the UK have the right to access high quality RSE, and this is often not an option to young people in custody. I'm so glad we've had the opportunity to do this project and provide these young men with the opportunity to learn safely about important key topics.
Judges agreed this was a wonderful example of positive impact of delivering services in appropriate settings. And the winner is Sophie Wilden, Medway Public Health, for her work in the RSE for All Education in Secure Estate. Congratulations to you all and enjoy the rest of your event.
Next up is translating evidence into practice in memory of the public health researcher Alison Thorpe. The finalists in this category are Joanne Smithson, Head of Implementation and Learning and Government and Health Sector Lead, What Works Centre for Wellbeing in Gateshead, which brought together 10 local authority policymakers, translating research and applying it in practice, building skills, knowledge, and insight. Christus Fernyhough, former Senior Public Health Officer, Barnsley Metropolitan Borough Council, who carried out a deep dive into suspected suicide cases to develop understanding and direct the suicide prevention response. Behavioural science trailblazer Lucy Smith, Public Health Principal, Buckinghamshire Council, has been working with the University of Bedfordshire to understand the barriers for local authority public health teams in applying behavioural science in their everyday practice. Let's hear now from our finalists for this award.
Hi, I'm Louise Hall-Anderson from Gateshead Council, and I nominated Joanne for this award for her fantastic work supporting local government colleagues with policy making to maximise wellbeing. Joanne is the Head of Implementation and Learning at the What Works Centre for Wellbeing, the UK's national body for wellbeing evidence policy and practice. Knowing what works to maximise wellbeing is important, but that's only part of the challenge. It's also important to know how to research findings in practice, and that's what Joanne's work definitely sets out to do. Joanne led a year-long peer learning project that brought together 10 local authority policymakers. The workshop supported councils to be agile and adaptive in their approach to build knowledge and to use wellbeing as a mechanism for organisational change. Working together, they developed frameworks, policies and dashboards. This was across a wide range of policy areas. Learning from this fantastic project has been captured and widely disseminated, enabling a new audience of policy professionals to successfully place wellbeing evidence at the heart of their policy making. Well done, Joanne.
Hi, I'm Christus. I'm a public health registrar in the North West, but formerly worked in Barnsley Council's wonderful public health team. This project was a deep dive into the case files of suspected suicides in Barnsley that included one or more previous suicide attempts. We wanted to explore the circumstances and risk factors that were potentially influencing people's recurring suicide attempts so that we could then put better support systems in place moving forward. We analysed demographics such as age, gender and occupation before completing qualitative thematic analysis, which highlighted themes such as domestic abuse, bereavement and substance misuse. The findings of our research provided the evidence base and the rationale to commission a pilot support service for people who've made a previous suicide attempt or who have suicidal intent. That service met a clear need, received hundreds of referrals, and as a result has been recurrently funded. Our findings also established a link between victims of sexual violence and subsequent attempted suicide, and as such have underpinned the rationale for completing a health needs assessment for victims of sexual violence in Barnsley. Although this was an emotionally challenging project, it's one that was completely worthwhile and one that has translated to improvements in public health practice. Thank you.
The Buckinghamshire Behavioural Science Trailblazer. The Buckinghamshire Council Public Health Team, in partnership with the University of Bedfordshire, has a health psychology trainee who is completing a PhD and Stage 2 qualification. Their research aims to understand how behavioural science is used within public health teams, what influences this use and what could support this moving forward. The outcome of this research will enable us to develop effective, sustainable and cost-effective approaches to incorporating behavioural science into our work. From the initial research, the team has received training to improve knowledge, understanding and application of behavioural science approaches. But it was recognised training on its own was not sufficient, so we now have employed a behavioural science practitioner who is providing in-house expertise in informing work programmes with the latest research-based practice. This approach demonstrates our contribution to this growing area of research and our commitment to improved evidence-based practice.
The judges said this was a remarkable project, which has already had great impact, an excellent example of translating evidence into improved practice. The winner is Christus Ferniehow for his work on suspected suicide cases. Our final award for this afternoon is the Best Social Media Campaign. The shortlisted entries are Laura Andre, Health Improvement Senior, and Heather Sloan, Health Improvement Lead, NHS Glasgow and Clyde, for their project #HideOutdoors to raise awareness of the benefits of nature to mental health. Deanne Birch, Lead for HEP See You Later, NHS Addictions Provider Alliance, for her project HEP See You Later, which uses strategic social media campaigning to reduce treatment barriers by dispelling myths and educating those at risk in treatment options. Let's hear now from our finalists for this award.
Thank you, Jessica.
Hello everyone. I'm delighted to have been invited to attend the UKPHR Awards. I have been a long-standing supporter of UKPHR over many years, both as a member of the Register myself and a scheme coordinator for my board, NHS Highland. The category for this award is Best Social Media Campaign, and the shortlisted entries are number 1, Laura Andre, Health Improvement Senior, and Heather Sloan, Health Improvement Lead from NHS Greater Glasgow and Clyde for their project #HeedOutdoors to raise awareness of the benefits of nature to mental health. And number 2, Deanne Birch, Lead for Hep See You Later at NHS Addictions Provider Alliance for her project Hep See You Later, which uses strategic social media campaigning to reduce barriers by dispelling myths and educating those at risk in treatment options. Now let's hear from our winning finalists.
Hi, my name's Lou. I'm the team leader for the Health Shop, which is part of Nottinghamshire Healthcare Foundation Trust and Nottingham Recovery Network. Our trust is a member of the NHS Addictions Provider Alliance, which has a hepatitis C elimination programme called Hep See You Later, which aims to eliminate hepatitis C across all drug and alcohol services provided by the NHS Addictions Provider Alliance's member trusts. I think it's amazing that the Hep See You Later social media campaign has been shortlisted for the UKPHR Innovation in Public Health Award. The social media posts enable me to see what's happening in other parts of the country. I've used the information as part of my training sessions, and we've been supported by Hep See You Later to post our own health promotion messages. I've also attended the webinars both as an attendee and a speaker. Our trust and the Drug and Alcohol Service have used the Hep See You Later campaign materials, and as a result I know firsthand it's raised the profile of hepatitis C across all our organisations and partners. I'm really, really proud to be part of the project.
The judges were very impressed by the way the winners of this category harnessed the power of social media to dramatically increase their audience numbers. And the winners are Laura Andre and Heather Sloan from NHS Greater Glasgow and Clyde, my neighbouring health board in Scotland. Very well done, Laura and Heather.
That concludes our awards ceremony today. This is a springboard for you to shine a spotlight on your achievements, so the ceremony and the winner's guide will be available on the website for you to share with friends and colleagues. Congratulations to all of our winners and finalists, and thank you once again to our sponsors, supporters, and of course to all of you for joining us. We hope to see you again next year.